In this video, we are going to talk about what we think is the best dental solution for you, and we are going to talk about what does it actually mean and why is it so important for you. So stay tuned until the end. So when the patient comes to our office, most of the time he comes because of a certain complaint, something subjective that is troubling him as a patient. So we ask the patient about his complaint, and he gives us his subjective response to it and tells the doctor, I have some pain, I have some problem with aesthetics, my frontal teeth don't look nice, I have a missing molar, and so on. So we try to tell the patient to tell us his own personal problems and wishes, which sometimes patients can be a little bit, let's say, shy because they think, they can be sometimes shy because they think that their opinion can be shallow because they want, let's say, a perfect white smile. This is something that we all dentists know and care about, but we want patients to confess about it. Why? Because we want to establish a therapeutic connection between us and the patient. Why? So we can create a reality check on what the patient can expect from the therapy that he can get from us, from the situation that he has in his mouth. So when we establish this connection, this therapeutic approach, we can then treat two things. And we need to treat two things with our patients. One is the mechanical part, missing teeth, crowns, veneers, composites, orthodontical treatment, dental implants, and so on, and patients' habits. Those two things are really, really important, especially the habits part. Why? Because of the bad habits in the first place, unless you had some trauma or some genetical anomaly, you were responsible for your own teeth to be in the state you had them when you came to our office. After that, when we establish the severity of the problem in the mouth, we talk about certain types of treatments that can be done to the patient, and then we suggest them, from our point of view, the best solution that there is for the patient himself. Why? Because we think that the most expensive treatment is not always the best one, because every patient is an individual and should be treated that way. And we need to, because sometimes we need to only do fillings or endodontical treatment or just clean the teeth, or try sometimes to fill the gap with proper orthodontical treatment and don't need to do any composite veneers or crowns or whatever. What is the best solution for the patient? So the goal of our therapy as dentists is to put a minimally invasive approach with maximal results. What does it mean? To put as less as foreign body as possible into the patient's mouth, such as crowns, veneers, implants, etc. and so on. So because there is then less anorganic material in the mouth. Why is it important? Because of the other part of the thing that we try to educate the patients that we talked about earlier. You have the mechanical part, the rehabilitation, the quantity and quality of components that we need to put to replace the missing or damaged tissue in the mouth, and the habits, the new habits you need to acquire and train as a patient to maintain that mechanical properties that you gain, that mechanical parts and properties of quality and quantity that you gain in your mouth. So this is really, really important, and this is equally important as the therapy itself, because sometimes the patients don't even want to talk about what is happening in their mouth. They're just saying, please doctor, just fix my teeth, make them look good and functional and beautiful, and I don't even want to know what's going on. This is completely wrong. You need to listen to your doctor, establish a good connection. Trust is a big, big, big thing. The doctor needs to tell you what he's doing and why is he doing it this way and not that way, because there are several different types of treatments that can be done in types of dental work. And you need to know after that how to take care of it, because this is your time, investment, and money in your own health, and you want to be as much as responsible in taking care of it, because you want that dental solution to be as much as possible, to be as long as possible in your mouth, for years, decades, and even more. So the point of this whole video is to give you and explain to you why is it important to give you the best individual approach for you, the patient, and how to take care of it. So the take-home message is find a doctor that you trust, find a doctor that you can find a connection, so he explains to you everything what he's doing to you that goes to your benefit, and how does it benefit you in, let's say, some other type of therapy, and how can you take care of it the best way possible, because this is your health, this is your mouth. You want your new habits to take care of those new prostheses, because everything you put in your mouth that is anorganic tissue, fillings, endodontical treatment, crowns, etc., is your investment, and you want to take care of it as best as possible. So I hope I helped you, and I gave you a different perspective on how to approach and to choose a doctor, a treatment option, and how to decide what is the best treatment for you. And you should then listen to your doctor and tell him to tell you how to take care of it properly, so it can last for decades and even more. See you soon. Bye.